Currently the Trust supports 91 high quality research studies that have been adopted by the National Institute for Health Research Clinical Research Network. These are considered to be the highest quality research studies within the UK that are of the greatest importance to the NHS. The fact that we've got 91 studies actually places us within the top 10% of trusts within the whole of the UK. Of those studies that we support, half of them are randomised controlled trials. And randomised controlled trials are considered to be the gold standard when assessing the effectiveness of new treatments and or new therapeutic modalities. The fact that we have such a large number of high quality studies highlights our commitment to high quality research and providing high quality care. It's also worth noting that the vast majority of patients want to be given an opportunity to take part in research, and therefore the fact that we have so many studies is great for our patients. And we should also note that those institutions that have the most research activity have also been shown to provide the highest levels of care and have the highest levels of patient satisfaction. Parkinson's disease is a progressive neurological condition that affects about 127,000 people across the UK. And it's characterised by a range of different symptoms, one of which is pain. Indeed, when you talk to patients with Parkinson's disease, they often report that pain is one of their major symptoms. So we were delighted when Dr. Raw and his team agreed to take part in this high-quality research study looking at the effectiveness of a new medication for pain relief in Parkinson's disease. This was the first international trial of its type. And we were delighted when Dr. Raw recruited the first 3 patients into this study in the whole of Europe. And it's fantastic to think that patients within Pennine Acute were given an opportunity to take part in such a high quality study that could affect the healthcare of patients with Parkinson's disease in the future. In 2012, the Trust was highly commended at the Health Service Journal Awards for demonstrating a progressive research culture. We were particularly commended for increasing the number of opportunities that patients have for participating in research. For instance, in 2012, 6 out of every 10 of our cancer patients were able to take part in a high-quality cancer study. Furthermore, we significantly increased our activity within diabetes, cardiology, gastroenterology and paediatrics. In addition to the Health Service Journal Award, we were also recognised at the recent Greater Manchester Research Awards, where we were finalists in 8 categories, which was more than any other trust in the whole of Greater Manchester. We won 3 of those categories and were runner-up in 5 categories, which was a really, really impressive achievement. The awards that we won were Research Administrator, the Infectious Diseases Research Team won Research Team of the Year, and Professor Philip Wiles was awarded a Lifetime Achievement Award for his commitment to diabetes research across Pennine Acute.